All right, good afternoon, everybody. It is 1:01, so I will get us started because we have a lot of good things to cover today. Welcome everyone to our February Food Security Community Call. If you please, as you have always been great about doing, introduce yourself in the chat with your organization. We are recording the call. Danielle will be posting the agenda in the chat shortly, so we can make sure everybody gets to see that. And I'm going to start with just a few updates from the Food Council, actually just a little introduction about what we're going to be talking about today first. So we're going to be joined by Councilmember Luedtke at 2 p.m. Prior to that, we'll focus on what we can do to better serve residents experiencing food insecurity, especially in light of the end of SNAP Emergency Allotments. And we want to discuss how we can connect residents to food and other resource programs. We've asked Monica Rivera-Goldberg from DHHS's CARES Navigation Program, and also one of our Food Council members, as well as Jordan Smith from Benefits Data Trust, to talk about their programs and the resources they connect people to. Also, Tato-Niktash from DHHS and I will do a quick review of how to make sure residents can find out about your food distributions and services. And we then hope to have a conversation about the resources you use to connect residents so we can all learn from each other. So just to kick things off with some updates from the Food Council, or things that we've been involved in recently. So first of all, the Montgomery County Office of Grants Management has created a survey to gather feedback from the county's nonprofit community to help reshape the community grants program and other grants management practices. The survey is open to all nonprofits who currently or aspire to operate in the county. Organizations don't need to be a current recipient of county funding to participate. And the goals of the survey are to guide reforms of the community grants, including cost-sharing capital grants, their structure, process, timeline, and goals, to inform the development of both the county's competitive grant program and grant agreement regulations, policies, procedures, and support resources, and to gain a broader understanding of the needs of the county's nonprofit partners to make the grants transition a success. If you have not already completed the survey, please do so. It will close this Thursday, Friday 16th at 9 a.m. Please submit only one response per organization. And we are going to share a link with more information about the survey, as well as a recording of the grants listening session hosted by nonprofit Montgomery, the Food Council, and some other community partners that was held earlier this month. Questions about the survey can be directed to Raphael Murphy, and we will also include his contact information in the chat. A quick update on school meals legislation. Just a follow-up from last month's call where Laura Hale from the American Heart Association shared about the School Meals for All and the Maryland Meals for Achievement funding bills. So those bill drafts have been written up and hearing dates are set, and we will be sharing information in our follow-up resource email if you are interested in providing written testimony or attending those hearings in person. So we will share that all electronically after the call. And my last update is a little bittersweet if you have not seen it already in our newsletters or heard from her yourself. An announcement that Heather Bruskin has left her position as Executive Director of the Food Council to lead the newly created Office of Food Systems Resilience in Montgomery County. So obviously bittersweet for the Food Council staff, as we will miss her, but we also know that she will do great things for food systems work in the county in her new role. That being said, we are looking for a new executive director, and we will share a link to the job posting in the chat. Heather will also join us on our March call to discuss the new office and her priorities and to hear your questions. So we hope that you can join us again in March to be reintroduced to Heather in her new role. So, wow, I talked faster than I thought I was going to, so we're moving right along. Which is great because then that will leave us more time to have a conversation. But I would like to kick things off with Monica Rivera-Goldberg from the DHHS CARES Navigation Program. And Monica, I see you there. I did share, I did make you a co-host, so you should be able to share your screen.
Yes. Hello, everyone. Thank you so much for having me. Please excuse my voice. I'm just getting over a bout of COVID. So it's a little scratchy. Finally got me. I like to tell everyone I hadn't had it yet. I'm very proud. So I'm just going to go ahead and share my screen. Just one second. Okay. And my name is Monica Goldberg. I am the program manager for the navigation unit, formerly known as the CARES Navigation Program. We are now the navigation team for Community Action Agency for the Department of Health and Human Services. So just a little bit about our program, if you guys haven't heard about us before. Navigation to us really started as a practice within HHS. So it was more of a service approach, which championed service integration, education, and hands-on guidance. So that means that we're bringing together all of HHS services to one central unit so that we have that no wrong door approach, right? We can funnel everyone in through one person or a navigator, and they can access all different kinds of services within HHS. So the types of services that we provide are application assistance for any type of HHS benefits programs. Those are state and county level ones, so SNAP, temporary cash assistance, things like that. We also provide education on those programs, whether that's training with our nonprofit or community-based organizations, and also within the county system. So we help with the minority initiatives for understanding on different SNAP applications, but also just with our clients, making sure that they know the different processes, the different eligibility requirements, what to expect for those renewals and next steps that they might have issues with, and how to reach out to us or other HHS services to be able to cater to them immediately. Financial resource connections. So we also do referrals with UMEAN, EMAN, and different local community-based organizations if HHS services do not provide those different kinds of assistance, because as you know, we've got some rental assistance for eviction prevention, but those little bills that might be a little bit smaller, there's not a lot of good services within HHS. But a lot of our community partners have some more free-form funding that we refer our clients to. Application appeals as well. If someone who feels like they were wrongly denied any type of benefit, we can help them appeal that and reach out to the appeals office and start that investigation. And then we also provide emergency assistance for people who are displaced from homes for fires when we are called to do so with our mass care team. So a couple of different programs. I know it's not a couple, there's a lot that we assist with. We've got temporary cash assistance, temporary disability, medical assistance, and then of course our working parents assistance program, also the child care scholarship. These two are really, really important because they can help get basically cash in hand for people who are falling off that benefits cliff right now. The emergency allotments are going away. Also, medical assistance, we're going to be seeing an expansion of that coming up soon. So these are other ways that your families can receive different types of benefits. And the Working Parents Assistance Program and the Child Care Scholarship basically pay for childcare. People can get up to upwards of $500, depending on how much childcare they need. It's a wonderful program. If your parents are already with Montgomery Work Source, they'll actually kind of walk them through the whole child care scholarship program and also provide them a stipend before they're able to get it if it takes a little bit longer. So that's also another avenue that you could go. Working Parents Assistance Program. This one is great for your parents that have gone above the income limits for SNAP. So if someone's changed their job, right, and that could be just that they got a $30 increase and now they're, don't qualify for SNAP anymore, they can apply for the Working Parents Assistance Program because that one has larger income eligibility than the Child Care Scholarship one does. And you also don't have to have any type of status eligibility. So no citizenship status, while the Child Care Scholarship, the children do have to be citizens. We also help apply for the different county health programs, Montgomery Cares, Care for Kids, HOC. These are other wonderful applications that people can apply for. And then we also do the normal food pantry referrals. We are based in local food and community-based organizations to bring a little bit of HHS to the community. We'll talk about that in just a second. And we also, under community action, which is where we are, we have the VITA program, which is the free tax program for people who make under $60,000. This is also really important for our undocumented families because they can get that I-10 number, start filing their taxes, and in 3 years, they could be eligible for an I-10 loan for home ownership. So that's really a pathway to building that generational wealth for those families who are doing a little bit better. Navigation and action. So as I said, we are found in Montgomery County food hubs and also community partner organizations. We also work with the mass care, emergency assistance and recovery programs. So we do all the case management for any types of mass events. That could be the Friendly Gardens explosion or the ones that we just had in Gaithersburg. We help families from the time of displacement until they are rehoused. We also do a lot of community outreach events. So if you guys ever want us to come out and see your families, we're more than happy to do so. We love to get into the community and make sure that people know how to access services and also assist them with that. Okay, and where we're currently found, and this needs to be updated, but Manna Food Choice Pantry, Interfaith Works, the Up County Hub, Test Center, and Community Action Agency. If you guys have any questions or want to get in touch with us, you can give us a call at the number on here. I can also put this in the chat. You can email me directly. One of the things that we specialize in doing is having access to the back end of MD Think and also other county benefits programs. So we're able to see where the program or where the application is in real time, different caseworker notes, and able to troubleshoot and directly contact, since we are HHS employees, to communicate with those case managers and get real-time answers for people who feel like they've been stuck. So you can also refer those kinds of cases to us. We specialize in that hands-on care, making sure that people have that application assistance if they can't do it themselves. And we have different language capacities: Spanish and Amharic, Pashto, Urdu, and Farsi. We also have the language line availability. So anyone can come to us with any type of barriers, and we're happy to help them out. But that's it. If anyone has any questions.
Monica, thank you so much. If anyone has any questions now, feel free to raise your hand or to put it in the chat. If not, I'm glad to move on to Jordan, and we can just kind of take questions then after all of those presentations or as part of our larger conversation about resources. So since I don't see anything immediately, I will turn things over to Jordan.
Thank you so much. I'll share my screen now. Okay, can folks see that?
No, Jordan.
Okay, let me try. Here. How is that? Can you guys see that there?
Yes.
Okay, perfect, awesome. So hi, my name is Jordan Smith. I'm the Maryland Engagement Manager for Benefits Data Trust, and you'll also see us known in some places as the Maryland Benefits Center, as we kind of try to localize work. We are a national nonprofit, so we're based out of Philadelphia. Sad for those Eagles fans, I am a Chicago Bears fan, so not too rough of a morning for me. I'm still doing well, but tough for them. But exciting for them to get the Super Bowl, and good people down in Philly, despite what all the gossip says. So exciting for we're excited to be here and excited to kind of talk a little bit more about what we do specifically here in Maryland, but then also some of the changes we are making with emergency allotments that we have been making, and how we can support folks if need be. So scrolling here, just going down to our mission. So a little bit about how BDT came to be. Our founder is named Warren Cantor. He actually, kind of a very cool story, kind of a self-made man, came from a middle-class family from Pittsburgh, or the Pennsylvania-Pittsburgh area, right outside, and made his money kind of in the credit card realm, and then was helping his mother get some benefits assistance. Actually, she was trying to get on Medicaid, and was looking at it and was like, I feel like I'm a relatively well-educated person, have done well for myself in life, and my mother keeps getting denied because the application process is so confusing. And this is coming from a man who's worked in credit card sales, right? So the application process, he kind of understood what all it entailed, what all it should be checking, and took that kind of model from the credit card industry and wanted to implement it into the benefit access space, and doing quick benefits screenings and doing multi-benefit screenings as much as possible. And so that's kind of how BDT came to be. So our goal is kind of to help people live healthier, more independent lives, and be more involved in a process that involves all of us, and when done correctly, can kind of lift all tides in a community, right? So that's kind of how we came to be. So looking at kind of how we do this work, what we're calling now the theory of change just came from an internal kind of come to Jesus, where our contact center met with kind of our other staff and tried to inform them, who are we, what do we want to be as we kind of look forward into the future. And I think the biggest thing that we always came back to is that we want to ensure that all of our work is call center focused, right? So our call centers, we employ almost 200 people in our call center supporting 7 states currently. And that does everything from screenings for SNAP all the way to if folks just call in and need a referral because they've gotten a letter that their voting address has been updated and they want to confirm that, that's a real thing. I listened in on a call last week, and that was a call that we got in, and how we can just support them and be better community members. And the way that we really do this is making sure that we kind of have a proactive model and outreach. So how do we make sure that we're reaching folks that are not only in need of benefits, but are also probably in need of benefits and are unsure that they're able to get benefits, if they can access those benefits, and maybe have never even been involved with the process or even thought that they can be on certain benefits because they make too much, but maybe they can get benefits assistance for the energy assistance that they need for their house because they make a certain level or they don't make a certain level. So I think, how do we proactively go out there and make sure that folks are involved with the process? How do we work with other sectors was a big thing too. I think not only, we're in the nonprofit space, so we're kind of in this little middle space where we support government, but we also support kind of for-profit, and we do a little bit of everything. But how do we make sure that the folks who are using the day-to-day processes of getting benefits are also helping inform those who are funding those like ourselves, who are going and assisting to make benefits, but then are also helping those who are writing the policies and who are implementing the policy know kind of what are the pitfalls, what are the good and what are the bad. And so that's where we try to kind of come in and do it at multiple levels. We work with the government kind of in any capacity that we kind of feel is right. One kind of new way that we're doing that with our policy team right now is they're doing kind of a states only conversation here in the next 2 weeks with some of our state partners across the country on how can we give them relief from the Fed, and how can we kind of attack that from a side angle, where we're having conversations kind of at the federal level and with different other partners, with our government innovation team and our policy team, and then how can we match that up what's happening here at the state level. And Maryland specifically is what I'm thinking of, but of course in other states as well. And then how do we do all of this with respect and make sure that we're getting accurate feedback is the big thing. I think more than anything, we can serve as many people as we want or as is possible, kind of with close to 200 BOS. But sometimes, as my mother would say, all money is not good money, right? And all great numbers are not good numbers. Increasing the amount of people we assist is always the goal, but making sure that we're doing that with respect and that we're maximizing what we can help people with is more of the goal. And then making sure that not only those folks, but our partners can give us feedback on that. How do we do this? Maryland is very interesting in the way that we do it as opposed to other places in BDT. We still kind of use this model of using data and analytics. So we utilize data sharing agreements with multiple agencies, match those files, and then we're able to filter out and say, okay, these folks, may be on Medicaid, but are not on SNAP, or vice versa. They're probably likely eligible for these other things, or EUSP and these other benefits. And so that's kind of how we kind of do outreach. But in Maryland specifically, because of, as many folks I'm sure know on this call, the high amount of folks who are doing outreach directly to the department and directly to us, we're more referral based here. We're kind of almost 2-to-1 referral based now versus outreach, where we're typically 2-to-1 the other way, outreach to referral. So there's a high need here in Maryland, and it seems folks are already kind of, which is a great thing, self-motivated to go out and seek that. And so we want to find a way to support that as best we can. So direct service, partner engagement. We as a nonprofit kind of are funded from multiple avenues. Philanthropy, through our work contracted with the state is kind of our one state partner. But as we were looking to expand into multi-benefits, that's where we kind of brought in philanthropy partners and say, hey, there's a need to do other benefits here outside of SNAP and outside of Medicaid work. And then a policy and practice, making sure that all of our policy is practice focused and written. So that way, it makes sense when people are utilizing it and as we're doing the day-to-day work. Again, our contact center, one thing I will highlight kind of for our contact center, they not only are they very strong, very great people who deal with a ton, and I'm honored to work with them. The quality and their ability to resource planning, I think is kind of the secret sauce there. Their ability to kind of monitor call rates, conversions, call volume, monitor that and collect trends and try to utilize that to share that with other partners. If we're noticing that, for example, emergency allotments, we're getting a lot of calls recently over the last couple of months about the change of emergency allotments. And so thus that's allowed us to start to put into place a IVR change. So on our hold line, giving folks information so that if they are calling and then they're transferred directly to us from DHS, as they often are, that they're not holding for 2 hours or 30 minutes to 2 hours or whatever the time is, when they could have, listened to that for 30 seconds. It's on loop and say, okay, no, this is a call that I know I need to email this person, or I need to formalize an appeal, or maybe, yeah, I do need to stick on the phone, and I can just know that I need to stay on the phone and this person can actually help me instead of kind of being bounced place to place, which can be very frustrating for clients. For our policy department, I'll move through here, but it really, I think kind of in the sense of emergency allotments, as things are changing, and as I think this will continue to get a little more confusing more than it'll get clarity, what changes need to be implemented, what needs to come from kind of the top down and what needs to come from the bottom down. I think that's the good thing about our policy team, is they try to implement it both ways, and we try to use kind of a information ladder, as most people in organizations are, right, where you're sharing information up and down and trying to keep everyone in the loop. And I feel like we do a pretty well job, but always can do better. Higher education, I'll share in the sense of, actually, I'll move through here a little bit and actually get down to kind of what we benefit, what we screen for, and then kind of what we're doing with emergency allotments, because I think it'll tie in well. So we do 13 benefit screening for at one time, kind of, we could be SNAP redetermination, which we also do SNAP redetermination texting. So if folks are up for the redetermination, we've been doing a pilot project with the DHS where we're texting them and letting them know and trying to get more touches on folks, which we've seen is very beneficial. Low income subsidy, Medicaid, MSP, MEEP, EUSP, HTC, RTC, SSDI, SSI, CHIP, ACA. We do all of those kind of, we could be doing any of those at any time. And when it comes to emergency allotments, I will say we've taken a multi-pronged approach to this, where we're kind of doing proactive outreach, where when we saw the emergency allotment was coming out, we worked with our policy team to know that this was not going to be a long-term thing probably, and it was going to eventually be sunset, so that we worked with every BOS and everyone that we worked with to get benefits, to let them know that this is what your benefit will be post-emergency allotment. This is what it is, but just FYI, right, when we can tell you this is what it's going to be post-emergency allotment, because we cannot tell you if the emergency allotment will be there when you get your benefits, right? It was one of those things, we never wanted to promise that, this was the big amount you were going to get and someone gets $20 because it's sunset and they were upset, and, that causes more issues. So we try to proactively let folks know kind of what was the change is going to be. And if folks call in, letting them know that, if we had the date in mind, well, now that we have it, letting them know when it was. If not, let them know we had no idea, but what the two changes could be. Again, updating our phone line with what, we keep a lot of information on there, Affordable Care Act information, Medicaid information, SNAP information, and adding this on there has been really beneficial, and clearing all folks off of the referral line specifically from DHS, who I think a lot of folks are calling there, getting stuck on hold and dropping off, which has been good. And we also have had a lot of folks calling and saying, no, I still think it's wrong, finalizing appeal. And we've had a couple people where the appeals come back and be like, no, this has been incorrect amount. So that's been good too. Collaborating with DHS and really just connecting them directly to our quality center and giving them trends directly. So like we were saying, where we had a bunch of appeals that were wrong, but then we had a couple of appeals that were right, and we noticed in specific areas, and we wanted to make sure that they kind of had that addressed at the local level if that was an office thing. And then our screening model allows us to be multi-benefit, which is we're maximizing right now, making sure that we're screening for every single thing possible and referring for other things, including food banks to other nonprofits if possible in the area, so folks can holistically get as much as they have been getting, even if it may not be in that amount. And then kind of future work to kind of offset that. Higher education specifically, we're working on a 4 community college pilot, working with kind of non-traditional college students, getting them aid and multi-benefits. And we're looking to expand that in the next year to multiple schools around the state, not just community colleges. And hoping to serve that crowd. And then also we're in the middle of setting up and tenting up a survey and outreach pilot with where we would be doing outreach and benefit screening for folks who are in the hospital or in the emergency room, and helping them get on benefits and getting screened before they leave to see, we're doing the screening, and other partners are interested in kind of the long-term health outcomes, but noticing that that's kind of a population that can kind of get caught into a very tough cycle if not aided. So I'll close out here with just some of the folks that we're here. Myself, you can always reach me through Alice, and I'll drop my email as well. And then the Maryland Benefit Center and our website, you can get it there. So I'll drop this all in the chat. But if there are any questions, I'll be around, so I'll be in the chat as well, but feel free. Thank you guys so much for having me.
Jordan, thank you so much. And I haven't seen perfect timing. That was my timer just going off right there. I don't see any questions yet in the chat or hands, but I actually have a couple of questions. And I think during this time, as people kind of let all of this information sink in, we'll probably see some more. So my first question for you is, you had mentioned your outreach to recipients about redeterminations and other benefits. Can you give us a sense of the scope of your work in Montgomery County? Like, do you have a number of residents that you are reaching out to, a percentage, of those who are already on SNAP that you're reaching out to about redetermination? I think just to help us get a sense of your reach in the county.
Yeah, so I don't have a specific number on Montgomery County specifically. I can work and get that over to Allison and the team. I will say, so we get, the way it works is we get essentially 3 data files a month from the state. And those essentially is the whole, anyone who is up for redetermination in that first one, and we text everyone. So if there are folks who are up for redetermination in Montgomery County, they're getting that text. And then that second file is kind of that file that we filter off of folks who have then done their redeterminations. We take them off the list, don't text them anymore, and kind of do that same filtering process each month. So that's how it works. So if there are folks who are on or who are up for redetermination in Montgomery County, they are getting a text from us. But I don't know that number specifically. I can check with our data team to make sure we can share that. But if so, I can share what that specific Montgomery County number would be.
Yeah, and I think, it sounds like possibly that you're reaching out to, if you're getting your list from the state, you're probably reaching out to, everyone who, unless they're only giving you a portion of that. But yeah, that would be helpful. And I'm assuming, are the text messages going out in a preferred language, or are they just going out in English? How does that work?
So it started in English about 6 months ago, and we started doing Spanish about 3 months ago, and have seen really good results on both. I'll toot our texting team's horn. The state's been really excited about the texting, and it's something, they said they want to see more. They want to do in more languages, and we just finished a redetermination evaluation that we're giving to the state soon, where we noticed it was done kind of in a crazy time, obviously, with everything going on. But what we noticed is that messaging for specific demographic groups was key, specifically around age, race, and their actual physical location. Baltimore City was something that we found a lot of interesting things on too. So the texting has been really great. So again, yeah, we are texting everyone across the state. So any Montgomery County folks are getting text. But yeah, we love that texting work, to be honest. I'll gush on that.
It just sounds like a key takeaway for folks on this call is that if you are hearing from clients that they're getting texts, that these are legitimate, texts that they can trust. So it's just good to have that information out in the community that, our community organizations can vouch that, you are a reputable source reaching out to them, because I'm sure, most of us would be a little leery about getting a text like that. So, yeah.
Absolutely. And if folks have advice or thoughts, again, you guys are the experts being there locally on language, that's the next thing we'd love to test and are looking to test kind of with some other partners and some other pilots is language specifically in certain areas. So we'd love feedback on that.
Allison.
Yeah, hi everyone. So thank you so much, Monica and Jordan, for your presentations. And you both brought up appeals and the appeals process. So I wanted to just focus on that a little bit if we could, because I know that letters are just starting to go out about emergency allotments ending. And so people are just now getting letters that are saying that their benefits are, going down, and, we're starting to get the calls, and I'm sure other people are too. And we've been told by DHS that it is that the emergency allotments coming down is not an appealable process. But I think that a lot of people are going to look at that amount that they're supposed to get and think that it's not right. As a state-funded CBO, we are not allowed to help people with an appeal, but we can certainly educate them about the appeals process. So I just didn't know if you guys wanted to speak a little bit about what the appeals process was, because I want to make sure that we all know that that's an avenue that's available to people if they feel like their SNAP benefit is not correct.
Yeah, so I'll talk a little bit about our appeals process, but also I'd like to talk a little bit about what you can do to help your clients before we even get to an appeal, right? Appeals, and I don't want to say they count against, but they are not seen as something favorable for caseworkers, right? No one wants to have an appeal go on there and have it go the wrong way. So they will always try to do what they can to be able to reopen the case if they've done something wrong. The majority of things that we're seeing for when we want to overturn a SNAP denial or any type of denial is that the client will turn in something at one of the regional service centers, and then they won't hear anything back. And then maybe a couple of weeks later, they'll get a denial notice saying that they never turned in this documentation. I can tell you, seeing the back end, that 98% of the time those documents are in there and just have not been looked at. I also want to be very gracious that our caseworkers have over 800 cases per month. Like, it's not even per year, 800 per month that they need to do renewals on. They're getting constantly new ones. So that can definitely happen. It's really important for you to advocate to your client that if they are telling you that they have turned it in, they most likely have, and it is probably in that system. They can call the Customer Service Assistance Center, or they can call us and we can give a quick look to that, see what's going on with their case, see if the documents were really in there. And that's when we would contact their caseworker and also the Office of Eligibility and Support Services to say, hey, we've noticed that this person had a denial, but they turned in their document on a date. It says that it was due on this date. Can you please reopen? I've never had an issue with them not reopening it. Now, if it comes down to maybe someone is sharing a household, and we see this very commonly where we have multifamily units in one unit, and they, due to language barrier or cultural barrier, don't understand the differences between, households, right? So if we have cousins living in a basement unit and we have mom and dad living upstairs, but they're all buying their food separately, those are two separate households. But the common question that they will say is, do you share food? Now, if you're living with your family, you're going to tell me that you never go upstairs and maybe like you share a meal here or like you invite them over, right? But that isn't what they're asking. What they're asking is this person a food provider? So that's also something that you can talk about. And this is the one that we would have the most trouble with, because once you've already rung that bell, right? Like you've already said, I'm sharing this food. Now it seems like you're kind of double stepping. So what we would do is we would file an appeals, and you can actually do them online. And we can, if I can look it up in my system real quick, I'll drop it in the chat so that you guys have access to that as well. And that goes over to the Office of Appeals that is helmed by David Carter, who is wonderful and really does a great job in listening to families and overturning these cases. He will always tell you that you always want to contact the Office of Eligibility first so that you don't get to that point, because it can be very scary, right? This does go to like a court system. It's not like a legal matter, but it is an actual court with a judge, and people can get very scared of that and say, oh no, like I'm going to be in court. What if I have, citizenship status? that, you know, I don't want them to know about. And so it's always about encouraging your client to always say, listen, this has nothing to do with citizenship. This is just about your SNAP program. And you should go forward, because if someone is entitled to those benefits, and I want to be very clear that entitlement is not a pejorative. This is something that they have worked very, very hard for, that their children should be having access to. Even if they aren't citizens, their children are US citizens and they deserve these benefits. So it's really important to advocate for that. But basically it would go to kind of like what you would see on TV, like those small claims courts type of thing, where they have a Zoom meeting, there's a judge there, they ask them a couple of questions. Almost always I see them overturned, but very rarely do I ever see them get to that process, because once you file that appeals, that's going to send a little ping over to HHS, and they're going to be like, oh, what's going on here? Most of the time that caseworker will reach out to that family member and try to rectify whatever is going on. But it is a simple process, but I think that the idea of having to go to court sometimes discourages people. But if anyone has any questions, or if Mike wanted to add in anything else.
So Monica, I had a question sent to me in the chat. So in your presentation, you did note locations where your program navigators are housed for certain times. If there is, I'm sure you have resource constraints, but if there are other organizations with standing hours who are interested in having a navigator on site, what would that process look like? Should they reach out to you independently, or are you just kind of at your capacity now? What would that look like?
Yeah, we actually just feel free to reach out to me. It's definitely, I want to say, like a lengthier process, because we like to give people chance, and we want to see, you know, navigation is a lot about community building. And some of our sites where we do it best, it's when we have integrated services with that site, and we have like the availability for office hours and to work together. So if anyone would like a navigator, we are not currently at capacity. We're actually onboarding a new person. So that's very exciting. And we're going to be looking for some placement for them. So please, yeah, feel free to reach out. It might be limited office hours, and it may be something that we do in the future. We're always looking to kind of expand our reach and make sure that, you know, all Montgomery County residents can access services and have the benefits that they deserve.
Thank you. So I don't see any more questions in the chat or any hands raised, but again, we still have time in this session. But just to keep things moving, I'm going to turn things over now to Diana from DHHS to talk about, just switching gears a little bit here. We want to have a larger conversation about other places where you might, other resources you might connect people experiencing food insecurity to other than food, but just a quick reminder too about what we currently have available to you to let residents know about food resources. So Diana will kick us off with that, and I'll give a brief update myself. Thanks, Diana.
Thank you, Annmarie. Thank you, Jordan and Monica, for those great presentations. Everybody, my name is Diana Tato, and I am the program manager for the food security plan at the Department of Health and Human Services. And I want to take this opportunity to thank all of our nonprofits for their hard work and the tremendous work that you did in helping us achieve our mission during the terrible times of the pandemic. Our mission is to promote and ensure the health and well-being of Montgomery County residents. And as the emergency allotment for SNAP and other benefits is elapsing at the end of this month, I believe, we expect to see more residents needing food, and we want to make sure that anyone that needs food can get it. So for that, I want to remind our partners that the county has food distribution calendar, and let me see if I can show you that. So if you go into the landing page for the Montgomery County government page, you can look down here, and can you all see it? Okay. So here's the Montgomery County Food Resources page. You can click on that. And you go to our food resources page. And so there are many resources here that are used by our case managers across programs, by school personnel, clinics and hospitals. And one of the most important ones that I want to bring your attention to is the calendar of food distributions, where you can see in many ways all the food distributions that are available in the county by day. And I want to encourage our food assistance providers in this call and our case managers, our food assistance providers, to please consider listing your food distributions in this calendar, and for case managers across programs to use this as a resource. If you are a food assistance provider, you can submit your food distribution by clicking on this link and completing this form. And the form gives you opportunity to list a lot of information in the location field. You should be able to enter information as far as whether there is a registration needed, whether people need to make an appointment, whether ID is required, or any other requirements that exist so that people can get food. If anybody has a question, please let me know, but I would appreciate, I'd love to see many more distributions listed in the calendar. Thank you, Annmarie.
Thanks, Deanna. I am going to also share my screen in a moment. So many of you are already familiar with and participating in the Food Council's Food Assistance Resource Directory and map that is available on our website. And I'm happy to say that most of the food assistance providers who regularly attend the food security community call, you are listed in that. We have some attendees who are not, and I will definitely be reaching out to you soon, to remind you that we're there and we're happy to share your information if you would like to join that directory. And then for those of you who are already on there, if you would also take the opportunity to check and make sure that your information is up to date. We know that there have been changes over time, and we have not done a full-on update in a while, just to resources on our end, but we would love to capture that information and keep it up to date. So I will include the link in the chat for you to take a look, but this is where our food assistance resource map is located, and residents can search by zip code, location. There's a number of different filters for them to consider, languages, any types of special features like delivery, and then the food assistance type. So I do just ask that, again, that you consider that. And, hopefully that's just another way that we can keep people, up to date on all of our resources. I will also mention, I know that there are providers that use a resource system called Find Help, which used to formerly be known as Aunt Bertha. And there are many healthcare providers that use that and other resource connections. And that is something that we have looked at. We have talked with them in the past because there's a number of different functionalities that are available in that system that we aren't able to provide in the Food Assistance Resource Directory. And so that's also something I'm looking into. Our friends at the Prince George's County Food Equity Council, many of their providers are signing up with that service to be able to manage their own information in that site about the many other resources that they provide along with food. And so I'm happy to work with them to host a training sometime in the near future about that system. And so I will keep you posted on that. But if you are interested, that is also another free resource that if you are not using already, we'd like to get more people connected with. And Jordan, I did have one other question for you if you're still here, because you had mentioned that you were looking to connect residents directly to food assistance resources. And I was just wondering how you did that locally, what resource you were using to identify sites for folks in Montgomery County.
Yeah, for Montgomery County specifically, I don't know if we have anything other than, I know our quality team and our contact centers compile a list of local nonprofits in each area that they can refer folks to. So I can update, and I'm going to update with this link, but that's kind of the extent I know. And I think that's for each locality mostly. So specifically, I'll leave that alone. I don't want to misquote. But yeah, that's how we did.
Just wanted to make sure there was another resource out there that we didn't know about that we made sure to find out about it. So thank you.
Yes, ma'am.
So we have have about 10, 12 minutes before the council member joins us. And so I think we still have some good quality time to have a discussion amongst ourselves about resources that many of us are already using, or types of resources that other folks on the call might be using that you are not familiar with, that you would like to learn more about. So Allison, Elizabeth, I don't know if you want to help me out a little bit with this conversation, make sure I kind of get right what we're looking to identify here. But I think what it is we're trying to find out is, who are your trusted resources? Who, what other programs are you connecting residents with? Are you a program that is not about food assistance, but, you'd like to make sure other people are coming to you for assistance, that maybe not everyone on this call is connected with you yet. So I think we're just looking for kind of a general town hall kind of conversation on your favorite resources, or the types of resources you would like to learn more about, and maybe someone on this call can help you connect with an organization that they are already aware of. Did I capture that right? Like we've talked about before, I'm going to learn to be okay with a little bit of quiet at first.
I'll start with just a question. Totally preaching to the choir here. We've all had these experiences, but I was just speaking with this couple this morning. They're both in their 70s. She just had a stroke. They just got SNAP in February, and now they get this letter that their $500 benefit is going down to $23. So already we have an issue there with their benefit level, and we need to think about that, but they don't have groceries in the house, right? So I'm looking around, sending them to the hub to get their weekly distribution and everything, but they're also immobile. They don't have great transportation. And so I was curious if anyone's doing anything in the area of helping folks navigate electronic online kind of benefits, or like they're super interested in maybe grocery delivery or that kind of thing. So I'm just wondering if anyone's working in the area of helping people bridge technology barriers or delivery barriers in order to get food. Those are the two areas that we see folks, especially our seniors, needing an awful lot of help with. So if anyone has experience there or is doing any work in that area, we would love to hear about it.
Are you referring to, say, delivery services for those who are shut in for food, for example, or other services?
Well, I recognize that in some cases, yeah, shut in, and it might be an acute situation, but I'm really thinking more long-term assistance for folks like the elderly who might not be able to, ever be completely able to get food on their own. And so thinking more long-term for them, you know, like we know that you can use your SNAP benefits to get online groceries, but if you don't have a computer or don't feel comfortable navigating that system, is there anyone helping to bridge those technology gaps to get the food to the person? I mean, maybe it's also a delivery issue, but like, so just helping folks who are chronically unable to get out.
I wanted to share something that I have been using when I have seniors in need of assistance getting their groceries. The Seniors Connection program has a program called the Pantry Fillers. I'm not sure if you guys are familiarized with that program, but the Pantry Fillers, they, at least my experience with that program in the Seniors Connection, to get them to, you know, the trips for the monthly visits to the doctors or to the pharmacy to get their medication. It's a fantastic program, and a lot of our seniors do not know that it exists. So if you do not know about it, seniorsconnection.org or something in that line, or Google it, because I am not in front of my computer. I cannot post the actual link, but the Pantry Filler program have assisted some of my most vulnerable clients with accessing obtaining their groceries. So I just wanted to share that too.
I think also I've seen in some announcements from the county about Senior Connection, there are often technology courses that people can participate in. Marla, you were going to.
Hi, I was just going to say that I can put the number of the senior program in the chat box because for eligible seniors and those that are disabled, there are programs available and meals that can be delivered directly to their homes. So I will put that number in the chat box right now.
Thanks, Marla.
And thank you, Maria, too. You know, I remember reading about that program at some point, but I feel like part of the value of these meetings and everything is getting that firsthand sort of review of how things are working. It makes me feel so much better to not only have that information here, but know that people have used it and it's working well. So thanks so much for that.
And Elizabeth Megan also shared in the chat that Hughes does meal deliveries for seniors, so that can be another resource that we keep track of.
Oak Chapel does as well in Lay Hill. So we have a person who does, in addition to the offsite food distributions, we do make deliveries to seniors, to people who are, say, struggling with COVID, shut-ins, maybe even family members who can't make it to a food distribution. And I could share our info with you as well.
Harvest also does the same, so we'll drop that in the chat as well.
And thanks, Casey. I was thinking of you as well with Food and Friends. So yes, those who have also serious illnesses. Oh, and Melissa, thank you for that reminder to Allison. You had mentioned before that seniors are getting incorrect benefit statement letters. So if you just wanted to mention that as well.
Yeah, so we've just starting to see the letters coming out, and our senior clients are seeing that their benefit's going to be $23, and that is not correct. So for anyone who is 62 or over, the minimum is $40, and that supplement comes in from the state of Maryland. So even though we were assured these letters would be correct that went out to seniors, we were also anticipating that they would maybe not be, and it does seem to be the case that they are not, that they're not correct.
Thank you. Any other kind of favored resources that someone would like to kind of applaud here, or ones that you've been looking for yourself that you're hoping maybe someone on the call is familiar with? And we will share all of the resources that are coming up in the chat in our resource email tomorrow. I think I did see, I haven't gotten a text yet, but I think I did see that maybe someone from the council member's office has joined us. If that's the case and you want to raise your hand, we can move on to that part of our presentation as well.
Hey, I'm Kate. I'm Councilmember Luedtke's legislative aide. She should be joining in a few minutes.
Great. Thank you, Kate. Welcome. Okay, just a note in the chat that AfriThrive also does deliveries within the Aspen Hill and Wheaton areas. And from Jackie, hi Jackie, that Manna Food Center also does deliveries for seniors and people with disabilities. They also have Lyft rides available in some cases. So that's another great resource. Does anyone want to share, I feel like we've talked about resources and, a little bit. Does anyone want to share any concerns, they have moving forward or things that you are seeing as a result of the emergency allotments going away? Is there information that everyone should be, aware of? Are you seeing increases at your food distributions?
Actually, now that you mention it, I am starting to be concerned about the senior citizens, how they're going to be able to access food in a more consistent basis, because the changes in the allotment, the standard is so low, and in the older they get, their mobility is less, their access to food is less. The real concern is like to provide that food in a consistent basis, because right now some of the programs available may be able to offer help once or twice in a monthly basis, but it's not stable, and our seniors are going to be really affected in the upcoming months with the inflation and the cost of food being so high. And I don't see food prices going back to what we were a few months before. So there is a real concern. There's a lot of older people who are going to bed hungry. I have talked to clients, things that wasn't the norm, who are experiencing real hunger, and they cannot work, or they availability to work, it's not really that much because they are over the age of 70. So it's concerning. I have reached out to a couple of colleagues to figure out ways of helping some of my clients, but do we have any idea of possible programs that are being discussed in a more like wider spectrum concerning that particular population?
Maria, that's a great question. I'm afraid I don't know personally, but I certainly ask anyone on the call, who is working directly with seniors, with county programs to, please share anything that, you may have heard, if there's anything in the works, or what the best way is to kind of get this information to people in, the positions who are making decisions about programs.
Thank you.
I could share a concern, and I think that this is a concern that's not necessarily unique to where I'm working, but it's also a concern that many of the hubs in the county have. It's about what's coming up here in the spring, May or June, when there's going to be, I guess, an adjustment in the budgets for all the hubs when it comes to the purchasing of food. And that means we might not be able to purchase as much before. And so we're seeing this perfect storm of the ending of the benefits, or at least a reduction of the benefits, and also a reduction in what the county is going to provide us insofar as basically providing food. Oak Chapel is going to do what it can to try to weather the storm, but that does not mean that other hubs are either prepared or would be able to weather that storm once it comes. So we're in a scramble for fresh produce, for example, and maybe even other stuff, but produce is just a start. It's not going to look good for us if we're not able to serve our community the way we should.
Thank you, Serge. And I think that was a lot of the impetus for this call today too, to talk about other resources, because we just know that, you know, it's going to kind of move throughout the system, right? Where they're looking for assistance when different funds and programs are cut off. So I appreciate you sharing that, and we'll definitely keep trying to bring you resources in our future calls that can assist with that. I believe that Councilmember Luedtke did join us now. There she is, great. I'm just gonna take a moment, if it's okay with you, to read a little bit from your bio to introduce you to our call, and then we're happy to get started. But Councilmember Don Luedtke is a community advocate, former Assistant Attorney General, excuse me, I'm losing my slide, certified law enforcement trainer and expert on healthy schools and public safety, serving her first term on the Montgomery County Council. She was elected in 2022 to represent the newly created District 7, which includes Ashton, Brookville, Damascus, Durwood, Laytonsville, Montgomery Village, Olney, Redland, Sandy Spring, and Northeast Montgomery County. She is committed to providing world-class constituent service, fostering a business environment for local small businesses to thrive, preventing crime through enhanced community policing, improving behavioral health and crisis response, and protecting Montgomery County's farmers, food, and agricultural reserve. She serves on the Council's Public Safety and Health and Human Services committees. So thank you so much and welcome for joining us this afternoon.
Thanks for having me, and I'm looking to see if Heather is on the call. Heather Breskin. I don't know if she's on today or not, or
Heather is not joining us today. Okay. She actually just had her first day in her new
job.
Yes. So she is onboarding, but she will join us on the March call. And but yes, thank you.
Super. Thank you. Well, I know Heather from my work at the state. One of many hats I wore with the Office of the Attorney General. I was assigned to counsel the state's Food System Resiliency Council once it was authorized by legislation in 2021. And so I had the privilege of getting to know Heather, and I apologize. I had to come home to take this call, and apparently one of my dogs would like to participate too. So if you hear a bark, it's just a small dog behind me. But Heather did great work in getting the state group up and running and organized, and I really appreciated all that I learned from being able to serve as their counsel during that time period. It's critically important work, and as you might have guessed from some of the bio that was read about me in terms of my interest in public safety and health and human services, emergency management and that universe is also a part of my world. And of course, at the state, the Food System Resiliency Council falls within the Maryland Department of Emergency Management. And again, I do view resiliency planning as much more than, I view it as preventive, right? It's not just what we're going to do to respond in the event of, and it's a lot about that interconnected planning and preparation and forethought and honing in on things that are a problem before there's an emergency, so that we are doing our best to triage and manage those even under normal operating conditions, as opposed to then what of course occurs once we find ourselves in an emergency posture. So I had been with the state for 9 years at the Office of the Attorney General and counseling multiple different agencies and entities throughout that time. But my prior practice, I was in private law practice before that for a number of 13 years. Yes, for 13 years prior to going to the state. And I come from South Jersey, so I'm a little bit disappointed in the Eagles' loss last night, I guess, I suppose. But grew up in South Jersey, where I grew up in a town called Williamstown, was very much an agriculturally based community that's now sort of lost some of that character through not very thoughtful development that happened in the 80s and early 90s in terms of strip malls and things that were put in what once was, family farming areas. So for me, the ag reserve here in Montgomery County and the fact that we've gone to great lengths to protect that land is incredibly important, because I came from a place where that was not thought of in advance, and now they're dealing with the repercussions of it. So but I as noted, I'm serving on public safety and health and human services committees, and of course food security touches both aspects in both committees, and of course I have a deep knowledge and love of issues related to education and education policy. And yes, I did specialize mostly in both the public safety and health and human services aspects of our school systems, but certainly within that, our nutrition programs are providing food to those who aren't going to have it otherwise, where schools are the hub and the place where many of our families, many of our children get all of their food. And I think people forget that or lose sight of that when that's not their lived experience. But that sadly is the reality for many. And of course, the challenges attendant to that as we shifted into virtual learning when the pandemic first hit, and how were we leveraging resources in each of the 24 counties to make sure that those students who were reliant upon those meals were still going to be able to get those meals. So I appreciate all that I've learned at the state level, and hope to be able to bring that back to benefit all of you locally. So thank you for having me today.
Thanks so much. So I have some questions lined up, but I'm also happy to start first. I want to make sure that our attendees, have the advantage of this opportunity to connect with you. So if there are questions, if you'd like to just raise your hand or put them in the chat, or feel free to send them to me directly, and I'm happy to read them for you, whatever works best for everyone on the call. But I'll give it a minute to let that happen. And if not, I'll take some of my conversation starters and then we can take it from there.
Sometimes in my old work, when I'd have to go talk to school children, like the principal would go, they're not going to ask you anything. So so I'd come with stuff. And then that was the day that they had lots of questions. I didn't have to touch anything I had pre-prepared. And then other days, quiet as a church mouse. So just depends.
Yeah. Well, I will tell you, just before you joined us, most of what we were discussing today is the fact that, the SNAP emergency allotments are going away. And many are, of our providers are working with residents who are unfortunately experiencing this perfect storm of the benefit reduction, higher costs of food, and more food assistance providers, working with an increase in those seeking services, but their own increased costs in purchasing food for residents. So I think, this group would, love to hear any of your thoughts on that. And I think also just in terms of general advocacy too, what is the importance of community engagement with your office and raising these kinds of issues? How do we connect with you? What's the best way to bring those types of concerns to your office?
Sure. So I will say, like we've talked about, just sort of mulling over the landscape of having had extra food service during COVID, and guarantee where you didn't have to apply for your free and reduced meals, and reducing stigma related to that, right? And it's not that every student at every school is going to eat every meal at the school, but the knowing that it would be available and finding a sweet spot of knowing how much it would be utilized and sort of, how much you need to be preparing per day, what other logistical changes might need to be dealt with, because there were some challenges in sort of running everybody through the lunch line as opposed to, and I have got 4 kids, so I hear a lot about lunch lines and opinions on food service. But that's something that I know that multiple of us on the council are thinking through, like, well, how can this work better, and how can we make sure too that the foods that we're serving at the schools, like how much can we make sure is truly locally sourced, because other school districts do. MoCo is not maybe best at that, but other schools do, and other school systems prepare food on site, which we don't. Everything's kind of just, if you pop it and warm it and then out it goes. And how does that impact or make a difference in terms of both the nutritional aspects of it and the willingness of the kids to participate and to use that, and reduce food waste too, because we don't want to be providing a thing that they're not interested in eating, or that's not culturally appropriate for the schools that are being served, right? And we may need to do some regional adaptations based on where you're talking about within the county, so that you're you're serving foods that are more appropriate for that particular school building, that they're interested in. So those are the types of things I've been sort of thinking through and talking with my team about in terms of researching and looking into, and examining some neighboring school systems that I know do prepare food on site, to find out, how much, what's the labor intensity of it, what's the cost of it, how are they sourcing it, and how much are the students availing themselves of being able to eat the school lunches, regardless of need, regardless of farm status. Just, this is the thing, this is what we do, and this is how we get it done. In terms of engagement and reaching out, well, certainly I think that, anytime somebody has ideas and they're able to share them and send them in to an elected official, that's useful. I think oftentimes people might perceive that goes into a black hole of some kind, and that's not true. We do have, I don't necessarily see every piece of email that comes to the office, right? Because I can't. But that's what we have other people in the office who focus on particular content areas, for example. So Kate, who's on this call, happens to have deep ties in the ag community. Kate also has a lot of experience with the disabilities community. So, everybody, no one person can know all the things. And every elected official should have folks on their team who are capable of helping them to understand policy areas that might not have been part of their prior professional experience, right? I feel fortunate in that I have had a lot of experience in a bunch of different content areas, and I love that. And I'm also just incredibly intellectually curious and like to read all the things that get put in front of me. But we do have other folks there in my office who are really awesome and can help with that. And in terms of testimony or testifying, both at the state and of course for the county council, I do think it's incredibly useful for people to come and share their thoughts, share their opinions, sign up to testify, submit written testimony. This came up, I worked a lot with law enforcement at the state, and I realized they didn't know, like the school resource officers, they were like, well, if we wanted to testify on something, we don't know how to go about it. Could you tell us? And then I just realized there was this whole like gap where nobody really said, okay, well, yeah, here's the, it's like the Schoolhouse Rock, here's how a bill becomes law cartoon. Like we needed one on, here's how do you raise your voice in Annapolis. Here's how you let yourself be heard. And sort of demystifying that for people is really, really important, because that is important for policymakers to hear from those who are doing the work, right? Whatever the field may be. And take that into consideration. So, certainly our office could help assist with if there is an issue that's on the council's agenda and you say, hey, we want to make sure we send in a letter, we are heard on this, and this gets before all the council members so that they can review it and take that into consideration while we're thinking through this issue, then we can make sure that that happens. And, you know, even I write letters, Kate maybe nodding, letters of support or raise issues of concern for state legislation that's pending now during the General Assembly session. When I see something where I'm like, oh, you know, that's a great idea, but you need to also consider this. So I need to flag that for you because that's important for my district or for our county or for the policy areas that I'm focused on. So.
Again, I'm checking the chat, but again, if you have, if any attendees have questions that you'd like to share, feel free to raise your hand or send them to me. I'm happy to read them. If not, I have a few others prepared that we can, we can keep moving. So it sounds like not just on county council issues, but possibly even, you know, for your constituents or for you know, folks with concerns about things that would fall under DHHS that have a state connection. It might, you know, it sounds like it could be worth residents reaching out to you on those state issues as well to, you know, provide that local perspective on how that would impact residents.
For sure. And I mean, there are a lot of things that are, you know, the person they're going to pick up the phone and call might be me or my office. And it might be something that we can't change locally, but we can go ahead and connect to or facilitate that conversation or pull together a meeting with the appropriate stakeholders who can. And I view that as part of our responsibility, which it is, it really is.
My next question was going to be about data collection and reporting, you know, and how relevant that is, or, you know, important that is in terms of telling, you know, our organizations telling their story to county council, and especially when they're reaching out to you on issues. So anything you wanted to share on that? Yeah, I think, and this is something that, especially when I was at the state, would always be fascinating to me, where people would come to testify and they wouldn't necessarily be talking about something in Maryland. They'd be giving an anecdote about a thing that happened, you know, in California or Oregon or what have you. And what the state lawmakers would tell you and what I will tell you is what I want to know is what's happening here or in my immediate area, right? It might be regionally based, but and while anecdotal conversations are useful, if you compare it with data, that's what really matters, right? So if it's just the anecdote and there's no data to back it up, or there's nothing else to tie it to, it's less impactful than if you have the data and the numbers to tie it to. I also find that that's particularly powerful when you have that data at your disposal and you've used it to advocate for your position. Then it takes some of the steam away from somebody who wants to go against you, right? Because you've already framed it in an objective fashion, as opposed to it being solely a subjective statement. Data is what it is. Now, you may be able to pick apart the data or tease out different nuance to it, right? You always can, but we do have a lot of rich data resources within the state and within the county. And so those should be relied upon, particularly for like our nonprofit partners who provide amazing services to our county residents. I think it's often hard for people to understand how vast the network is of these different providers in different spaces, whether it's food security or our mental and behavioral health providers, or, you know, our homelessness outreach and support services. It's hard for people to understand how they all work together and which sort of services are provided, which ones somebody else might do, and knowing that y'all communicate together, because
that's something that I do know happens. Like, I am very aware that the different nonprofit partners are very good about being collaborative and working together. But it's not clear to me that, one, that the general public knows that, or two, that all policymakers are aware of that. And I think that's really, really important. It's not an either or, it's an and making sure that you have the story to tell that shows why it's an and not an either or is incredibly important.
Keep providing a little bit of space. So, oh, I see something in the chat. Okay. I'll just share it for those who may be participating by phone. Because of your unique state and local perspective, what are you most excited about as a result of the White House Conference on Hunger, Nutrition, and Health?
Well, one, the spotlight, the national spotlight, right? Anytime you can get a national spotlight on issues like that folks in the grassroots area have been advocating for years, is incredibly powerful, because it means that there's greater chance of resources being directed out that then can be utilized locally in more powerful ways. It also helps focus, again, local policymakers on understanding the critical importance of this when the White House has elevated it to that status. And, things that were wrong before the pandemic. And for me, I feel like, the pandemic exacerbated a lot of things. And in some cases, there are things that, I'm a little disappointed that it's still taking till late 2022 or 2023 to get a spotlight on, because these are things that anyone working in these different fields has been aware of for a long time and have been trying to get attention on. But at this point, as long as we're shining the spotlight, then let's buckle down and get to work. So.
I do have a question. Thank you for your time, Councilmember Luedtke. My name is Serge Thomas, and I am the Community Engagement and Partnerships Director for Oak Chapel's United Methodist Church's Food Hub in Silver Spring. Mm-hmm. And I recall seeing something in the Governor's State of the State address about the Family Prosperity Act. And I just wanted to know what are your thoughts on support of the act, which would do a lot to expand the child income tax credit, which I believe could be a force multiplier in combating food insecurity, especially mm-hmm. here in the county. And thank you.
So for those of you who don't know, my husband is the governor's chief legislative officer. So, that we don't always talk about work at home, but we do talk about work at home. And I know that there have been a great number of things that have just been filed where that's been put through. And of course, the tax credit would be incredibly helpful. So yes, definitely supportive of that. But again, those are things that need to be done at the state level. That's not something that we can implement here locally, but that's something that, I'm thankful for is on the governor's radar and is something that is being pushed forward and advocated strongly by the administration during this legislative session.
You're still on mute.
Thank you. Every now and again, I make my own mistakes. So just another question about, the role of the Health and Human Services Committee in developing policy. If you can explain a little bit about that.
Sure. So the committee will hear any bills that get filed by any council member, right? So you don't have to be a member of the committee to draft legislation that'll be heard by that committee. So for example, I had a bill that was introduced 2 weeks ago. Have another one that's coming tomorrow. Both of those bills are bills that go in what we would call the Government Operations Committee. Right, they have to deal. One has to do with the Open Meetings Act. One has to do with HR policies for hiring of county employees. So they're not related to either public safety or HHS. But within the committees that we sit on, it's where you hear briefings or items that are of direct relevance to that particular policy area. So sometimes it may be like last week, the HHS committee sat for its first session as a standalone. And that was on homelessness and homelessness outreach efforts and coordination within the county. We previously had a joint session of the public safety and HHS committees that I had organized related to crisis response and the network of services at issue in the crisis response landscape. So that's where we sort of talk through and figure out and have discussions about what is happening already, where there may be gaps. You know, this morning we had a public safety hearing on the staffing shortages, for example, within the police department and also within our emergency communication center for our dispatch operators. So then at other times you're talking about particular pieces of pending legislation or decision making where the body has to take a vote on what to recommend or not recommend back to the full body before the bill goes back to the full body for approval, discussion and approval, or non-approval, because you can say no. Yeah.
Thank you. I did get a question to me in the chat, so I'll read that here. Locally, what can be done to assist with the influx of newcomers and immigrants? And also, while you were speaking about crisis response in relation to newcomers as well after hours of sheltering.
So yeah, that particular, when I was talking about crisis response, it was talking about someone who's having a mental or behavioral health crisis and or an agitated patient, because you can have agitated patient or an agitated person based on head trauma that doesn't necessarily have a corresponding substance use or mental health disorder. In terms of coordinating services after hours, right now we do have very limited teams who do the crisis response in the overnight hours. That's really handled by law enforcement. You know, in terms of displaced individuals in the evening hours, it really, right now, it's mostly left to a law enforcement function if that should happen late in the evening. But, you know, greater coordination of, and I don't know whether you meant by like evictions being executed, or did you mean by simply people arriving late in the evening and requiring shelter? I'm not entirely sure which you're looking for.
I haven't seen anything new. I'm assuming arriving late, yes.
Arriving late, yeah. So that would, you know, largely be directed through you know, unless there's coordination with a specific group that's doing that kind of outreach. Yeah, then that's falling on public safety, which it's not really a public safety function, and that's something we need to improve.
I do have another question in the chat, and I also realize it's 2:29, so we can ask this one, but and then any others that we have, I'm happy to send on to your office. What are you hoping for in the next fiscal year budget in terms of support for the various food hubs, community food distributors, et cetera? They know that the county executive's budget is not out yet, but do you support funding at the same level, lower or higher, given the continued and increasing demand?
Yeah, I certainly can't say we'd have to lower it. That would not be, that's not where we are economically. It's not where we are in terms of need. It's not, you know, that's just not feasible. You know, would we wish we could have less need? Absolutely, because if, you know, if we have less need, then we're doing much better overall as a community, but that's not where we are. You know, we're going to have to take a big hard look at how to make sure we're meeting both the needs with the increased cost in purchasing goods, because, you know, that's something impacting government operations across the board, you know, whether it's building construction and the supplies to do the construction, or the services, you know, getting the supplies in order to make sure that you all can do your jobs. It's just a factor that we can't ignore and we have to deal with. Otherwise you create additional problems down the road. So I'm very cognizant of that. I'm going to make sure I put my contact information in the chat for you so that you have that and you can reach out anytime.
Thank you so much. And we'll be sure to share that out in our resource email so everyone has that handy. But thank you so much for your time today, council member. And again, if I get any other questions, I'm also happy to forward those on. But thank you to all of our speakers today, to the council member, to Monica Goldberg, to Jordan Smith, Deanna Tato, and everyone just for engaging in this conversation. Like I said, our next call will be Monday, March 13th, and we will be joined by Heather Bruskin in her new role, leading the Office of Food System Resilience. And so we will continue these conversations then. In the meantime, if there are resources, organizations, programs that you know you would like to learn more about, please do not hesitate to reach out to me and let me know. We're always happy to take suggestions for what you want to learn and engage more about.
Thank you all.
Thank you for having me.
Thank
Thank you, council member. Thank you, Annmarie. Thank you, everybody.
Thank you.
Thank you, everyone.
Thank you.